Hi, my name is Nurse Nancy and I'm a nurse practitioner. And here are a couple of experiences I had with the treatment of some patients regarding contraception. Come in.
Hello!
Hi!
Hi, my name is Strawberry Rain, and I was told to come to you because, you know, in my time in my life, I have many sexual partners, and at this point, I'm not ready to have a baby, and I don't believe in any hormones or chemicals. I'm all natural, so I just wanted to know what I can do so I don't get pregnant at this time.
Yeah, that makes sense. You do have some options.
Okay.
First off, I don't know if you've ever tried condoms. They are non-hormonal.
I have tried condoms, but the problem is I'm allergic to latex.
Oh, that does make it tricky.
Mm-hmm.
Yeah. So there are a couple different kinds of non-latex condoms, but the most affordable is usually ones made out of lambskin, and they can't prevent STIs.
I'm vegan.
Oh, you're vegan. Okay. You know what? There's another option for you.
Okay.
Another one is called natural family planning. That can help prevent pregnancy. It's only about 76% effective.
Oh,
and it actually requires quite a bit of work from you, but there's no cost. So that's definitely an upside.
That's a positive, yes.
Yes. So a couple things you want to watch are, first off, taking your temperature every day. Do you have a thermometer?
I do have a thermometer.
That's good. So you'll take your temperature at the same time every morning.
Okay.
And you'll watch for a decrease of about 0.5 degree Celsius.
All right.
And from your normal. So you'll have to kind of watch it for probably a whole cycle before really relying on it for birth control. But you'd watch for that decrease, which will indicate that your body's about to ovulate.
Okay.
And then you'll have an increase by 1 degree Celsius. And that will indicate that your body is currently ovulating, and that won't be a safe day to have sex because you could potentially become pregnant. So the main thing you want to do is stay away from intercourse 3 to 4 days before ovulation and 3 to 4 days after.
Sounds like a lot of days.
I know. So an important part of family planning is actually having a good way to track it.
Okay.
A lot of people use an app on their phone.
Oh, I don't believe in phones. All the electromagnetic stuff. I read an article. It was a very educational article.
Oh.
And I don't want that near me. So.
Okay. So there is actually something called cycle beads. You have a set of beads that are about 32 beads.
Okay.
And there's different colors representing fertility. So you have a red bead that represents the first day of your cycle, and then brown beads representing days that are okay to have sexual intercourse, and then white beads representing ovulation, days that you would abstain. Does that make sense?
I think so, but I'm going to change the brown beads to green. It flows better with my aura.
Sounds good.
All right.
Whatever works well for you.
Thank you. I like that. I do like my beads. All right. Well, thank you so very much. I appreciate you. I'm just...
Oh, and I forgot to mention, also, I know that it's kind of gross sometimes. Some people aren't as familiar with their bodies, but cervical mucus is also a good indicator of ovulation.
Okay.
I don't know if you've ever seen egg white. You sound like you're kind of stay away from that kind of thing.
I went to a poultry farm once, and that's why I'm vegan. So I have seen it. It was quite traumatizing, but I do know what it looks like.
So egg white is going to be the consistency of the cervical mucus that you're going to want to stay away from sexual intercourse, because that's also going to be a good way to get pregnant. So stay away from both of those things, and I think that you should have a pretty good way of staying safe.
It sounds pretty simple enough, and I love that it's all natural.
Yeah, it sounds like a good option for you.
All right. Well, thank you so
very
much.
Nice to meet you.
Oh, I'm a hugger, honey. Come here. Oh, come here. I appreciate you. You're so wonderful.
Thank you so much for coming in.
Have a wonderful day.
Come in. Hello, you two. How are you doing today?
Yo, what up? I don't know. I'm Tiffany.
T-Bone. Hi, T-Bone. What can I do for you?
So we were bringing all night.
I tap that. Woo! Give me some. Give me some. Yeah.
Anyways,
Okay.
Yeah.
I think I might be pregnant.
Oh, okay.
But you can't tell our parents we're here. Otherwise, I'll be toast. Like Toast.
Oh, how old are
Toast.
you?
I'll be 16 in 6 months.
He's
Oh.
getting so old.
Oh, okay.
I'm only 15 in like 3 days.
Okay, so pretty young. Do want to prevent pregnancy. That sounds like a good idea. So you're not necessarily pregnant right now, just from
okay.
last night. So you do have some emergency contraceptive options.
Okay.
So there are 2 different pills.
What does that mean?
Oh, birth control.
Oh, so like pull out. My pull-out game is not weak. You know what I mean?
So withdrawal method, what you're talking about, it can be a good option, about 78% effective, but that's still 22%.
Yeah,
So-
I can't be a baby
and-
daddy.
And I mean, sometimes it's really hard to kind of stop in the heat of the moment. So
You're not wrong.
I sure am not. But we do have Plan B, and we have Ella, which you can take today, this morning. You'll take one this
Like with
morning.
breakfast?
Yeah, that would actually be a good idea to take it with food because it can cause some nausea and cramping. Do you ever have cramps with your period?
Like the tummy aches?
A little bit lower, but yeah, so it can be really
Yeah,
uncomfortable.
sometimes, yeah.
So you can take ibuprofen for that. And then you'll take another one 12 hours later. And that can prevent the pregnancy from going forward, okay?
Yeah.
Okay. And then do you guys have any plans for after this, like long-term contraceptive options?
Can we just keep doing this?
This isn't actually a good long-term solution, just effectiveness-wise. Plan B is only 80% effective on its own, and you don't want to always have to rely on taking a pill the day after. And there are some really good options, such as the Paragard IUD, which
Like a bomb?
Cause she's smoking.
oh, that's so sweet. But IUD, not IED. IUD stands for intrauterine device. So that's a little plastic copper T-shaped thing that we put in the uterus, and it kind of irritates the lining to prevent any inflammation. So, and that is something we can do today in the office if you wanted.
Does it hurt? Like, is it gonna hurt? Because I don't want to hurt.
So it can be a really uncomfortable procedure.
Okay.
It is a lot of cramping. You can have more cramping and bleeding with each of your periods.
Can I still have sex?
You can still have sex.
We good.
Okay.
So, and it lasts for 10 years. So
that sounds like a good option.
See you